So hi there, my name is Lucy, and I'm here to talk to you about emotional well-being. I've been a community health nurse for 34 years, and I've been a nurse with NTC for the last 9. I have a passion for mums, babes, women's health, and I work at the Strong Family House on the second floor of that old post office building on Argyle where the CYS staff are located. I have a lot of experience with helping mums through difficult times, including substance use. And for those of you who knew Heidi, well, I'm the new Heidi. So today I'm going to talk to you about emotional health and wellness during your pregnancy and the postpartum period. I want to talk a little bit before we start about trigger warnings. Things that we talk about today, or I talk about today, can bring up thoughts about your own upbringing, circumstances around your family, memories that might be good or bad, scary or stressful. So be sure to take some deep breaths and take time for yourself. Walk away from the screen if you need to, and know that this discussion is to help teach you ways to walk through the challenges that you might face emotionally through your pregnancy, postpartum, and parenting journey. So we're going to talk about statistics, and these also include those situations where parents are adopting children. So about 23% of parents will experience depression or anxiety during pregnancy or after a birth. Worldwide, about 10% of pregnant women and 13% of women who have just given birth will experience a mental disorder, primarily depression. Although many women feel happy during pregnancy, some women don't. And for adoptive parents, the symptoms and rates of occurrence, 1 in 7 mums, 1 in 10 dads, are similar to postpartum depression and can also include unsure feelings about tough decisions, adjusting to a new parenting role, bonding issues, or in the case of some adoptive parents, unresolved fertility issues and more. So hormonal changes and expectations. So the feelings that a mother faces throughout her pregnancy can be very different from each woman. In the first trimester, a woman may feel excited, confused, tired, or all over the place, wondering if she's ready for all of these changes. These feelings are all normal and may be related to hormonal changes. Then, in the second trimester, a woman may begin to feel better because she's got rising energy levels and her emotions may be a little bit more balanced. And then in the third trimester, once again, she might start to feel uncomfortable and tired, start to worry about how she looks, begin thinking and worrying about labor and birth. And again, these are all normal emotions, and they all can be related to hormonal changes. Our bodies have dozens of hormones, which are complex body chemicals, and each one performs a different function. During pregnancy, special hormones circulate in your blood at much higher levels than any time before. They increase your strength and your sense of well-being. Within hours of birth, though, these levels of hormone undergo tremendous change and can drop drastically. Many doctors think that the plunging hormones after birth contribute to postpartum depression. You simply can't control these changes, and so therefore you need to remember that you can't control how these changes make you feel. Alongside these hormonal changes are other contributing factors, such as expectations of yourself and others. Perhaps you've had to rapidly wean breastfeeding, not knowing, self-doubt, poor sleep, feeling alone, trying to live up to an impossible dream of perfection, and the overall adjustment of bringing home a new baby. All of these feelings, along with the hormonal changes, can lead to further feelings of guilt and not wanting to talk about the negative feelings that you're having. Keeping quiet about all of these things can cause even further challenges to your emotional well-being. Caring for a newborn can be so physically and emotionally consuming that who you are seems to get lost in the shuffle. So adjusting to new life with baby. There are basically 4 categories that we talk about when it comes to depression after a child's been born. There are baby blues, postpartum stress syndrome, postpartum depression or anxiety, and then postpartum psychosis. And it's a continuum. It goes from one to the next if things don't get better. So we'll go through each of these. So baby blues are the most common form of depression. It's usually short-lived, lasts no longer than 2 to 3 weeks, and it shouldn't interfere with your life. It usually goes away on its own. You feel happy at times in the day, but you may also feel sad, isolated, resentful, exhausted, anxious, and tense, and you might find that you're crying more often. These feelings don't last all day long, but they rather pop up randomly throughout the day. It doesn't get increasingly worse. Remember that there's nothing wrong with feeling this way. It's okay to cry. Don't forget to take care of yourself. Sleep when the baby sleeps if you can. Eat nutritious food, and ensure that you have support with chores and caring for the baby and any other children that you might have. Postpartum stress syndrome is also known as adjustment disorder, and it's the most common kind of persistent depression and anxiety. So unlike the baby blues, you have a constant sense of feeling bad about yourself. These feelings don't go away during the day. The disorders and the feelings can typically last 2 months with a mixture of good and bad days. Symptoms might include feeling not yourself, feeling overwhelmed, excessively crying, feeling helpless, feeling doubtful, and changes to your appetite. Again, all these feelings are normal because of the exhaustion, the hormonal changes, and feeling overwhelmed by motherhood. So this syndrome varies a lot among parents depending on the type of stress that you have and what resources you have at your disposal. But when you start feeling this way, this is when it's really helpful to start seeking out professional help at this time. Okay, so now we get into the true postpartum depression and anxiety. The feelings associated with this are the same as the baby blues and the postpartum stress disorder. However, again, they're much worse, and they include now confusion and feelings of worthlessness, feeling distracted, extremely agitated, having panic attacks, and an overall inability to laugh. The symptoms interfere with your ability to complete daily tasks, and this lasts 6 weeks or more. There are major changes in your energy, your sleep, your appetite, your ability to concentrate, be motivated, or to initiate things. Your mood does not match the situation, and it doesn't change as the triggers change. It's extremely important to seek out help at this point because there's very strong evidence that shows that this can negatively affect the attachment that you have with your child if you don't seek support and help. The last category is what we call postpartum psychosis, and this is a true medical emergency. It's very rare, and it only occurs in about 1 or 2 women out of every 1,000 women. But it typically has a very fast onset. It occurs 1 to 3 days postpartum. And women who experience this experience a loss of reality. It's a psychosis. Their judgment is impaired, and they have confusion that can be life-threatening because sometimes they have thoughts of harming themselves or their baby, or they have very scary fantasies or hallucinations. So this disorder poses a great threat to the life of the mom and or the baby, and help has to be sought immediately. This requires expert assessment and care. This might be actually something where moms wouldn't be treated locally in hospital, but might land up having to go into Victoria or Vancouver for special psychiatric help. However, the good thing to know is that for those poor women who do suffer this, over 90% of them recover completely. So seeking help. Being a mom is one of the most demanding and important jobs that anyone can do, but it's definitely constant, and as I said, it's demanding, and it has lots of changes to your day-to-day routine. There will also be times where you will feel completely in awe of having brought a wonderful little person into the world. So being a resilient mom is having the ability to withstand or recover quickly from difficult situations and conditions. Do things to stay strong. Take time to enjoy those precious moments with baby, even if the laundry pile grows or the dishes don't get washed. Family, friends, and community are often happy to look after the baby while you take some much needed time for yourself. Connect with culture, ceremony, and events. They'll give you a source of strength and empowerment. Spending time at cultural events can help you learn good ways to bring up your children from aunties, elders, families, or relatives. Keep a strong belief in yourself. You are doing a good job. And things to remember like chest breastfeeding or skin to skin with your infant is a wonderful way to bond with your infant. It has many positive effects. So when you study postpartum depression, there's a very clear understanding that in communities where you see more support, there's less depression. And you need to remember that depression isn't an illness and it's not a reflection of you as a mother or as a woman, all right? So sometimes you might need medical assistance to help you feel like yourself again. This may include counseling services and or medication. So determine if this is the best route suited to help you out. Healthcare providers generally use a tool called the Edinboro Postnatal Depression Scale. Edinboro is a place in Scotland, and that's where this scale was developed. And for those of us who help moms, we call it the EPDS. So we use it in pregnancy and typically at 6 to 8 weeks postpartum, and it helps us screen for depression, but it doesn't diagnose depression. And this is what it looks like. We basically ask a series of questions about how you have been feeling in the last 7 days. So it's normal for us to ask you to complete this screening, and questions you might be asked will include things like, have you been able to see the funny side of things? Are you looking forward to things? Are you blaming yourself unnecessarily? Are you feeling worried or anxious for no good reason? Have you thought of harming yourself? Among other questions. So this tool has been used worldwide, and it's been proven to assess anyone's state of mental health. If it's determined that you are suffering from an emotional disorder, you screen high on the EPDS, or you have discussions with your healthcare provider, they might recommend you see certain physicians as well as get maybe different therapies. So therapies usually promote personal change. They increase your awareness of yourself within and help to shape different patterns or strategies in your life. So one example of a therapy is called cognitive behavior therapy, and that focuses on understanding thought processes and how they contribute to you feeling depressed or anxious. Additionally, some people may also require medication. So medication can be very important to regain your wellness and your function, especially if those symptoms are severe. These medications change psychological symptoms, but typically counseling services are also needed. So it's important to note that even if you are being asked to use medication, the safety of mom and babe during pregnancy and breastfeeding is always considered by the doctor. Medications can help remove the physical symptoms of depression, reduce the length of depression, and can help people sleep better. It's a way to improve the way that a woman manages her whole life. One approach that you can also do that doesn't necessarily involve therapy or medication is a term that we call nests. We suggest that you eat nutritious food, you get some exercise every day, you try to get enough sleep, and you find a bit of time for yourself, hiring a babysitter or asking the family to help, seeking out support. There are many, many resources that are out there, so don't feel like you're in this alone. You can reach out to your healthcare provider, You can reach out to HealthLink BC, the Pacific Postpartum Support Society, BC Reproductive Mental Health Program, people at the Friendship Center, People in Your Nation, CUA's Crisis Line, Victim Link, look through the Baby's Best Chance, Toddler's First Steps, go to the Canadian Mental Health Association, as well as a resource that we call the Period of Purple Crying. So in conclusion, we understand that there's a lot of shame and stigma surrounding postpartum depression. So it's important to seek out help when you find yourself not feeling like yourself. Postpartum depression is a mental illness, and we don't want you to suffer silently at home. Seek help. You're not alone. Different women will take different paths to feeling better. Treatment decisions are personal, as is the journey of your health. All right, thanks very much for your time.